everyone, I am Dr. Srivalli, Consultant Medical Oncologist from Sri Shankara Cancer Hospital. Today we are here to discuss some of the common myths associated with chemotherapy. So in cancer, there are three forms of treatment. One is surgery, second is radiation and third is systemic therapy. Among systemic therapy, there are three forms. One is chemotherapy, second targeted therapy and third is immunotherapy. So what is chemotherapy? Chemotherapy is derived from two words, chemo meaning chemicals, therapy meaning treatment. So it involves the administration of chemical agents in the form of IV fluids and is given in the form of drips in order to kill the rapidly dividing tumor cells. So why is chemotherapy prescribed? The most common myth is if he or she is prescribed chemotherapy, they think that he or she is terminally ill, all is over, for which the answer is a big no. So chemotherapy is given prior to definitive treatment like surgery or radiation to shrink the tumor, post-surgery to decrease the chances of recurrence, in metastatic setting to decrease the tumor burden and to keep the disease in a stable form, that is in a controlled form. Thus, chemo helps to decrease the tumor burden and improve the cancer symptoms. So how is chemotherapy administered? Most common myth is people think it's a complicated form. No, it is given most commonly in the form of an IV fluid, that is in drips. Which chemotherapy? Myth associated is it is the same for all cancers. No, different chemotherapy drugs are used for different cancers. Most commonly given over a single day. However, it can also be given over 2 to 5 days depending upon the tumor. And the frequency most commonly given every 3 weekly. However, there are a few regimens which are also given weekly, 2 weekly, etc. So where do we give chemotherapy? Single day regimens are administered in our daycare. Those regimens lasting for 2 to 3 days, we admit the patient and give it in our ward. How should the food habits be during chemotherapy? Most common myth associated is they need to be on a specialized diet. No. Prefer home food, eat boiled and that is cooked food, avoid outside food and junk food, no raw food, fruits you can wash, peel the skin and have, you can have non-veg, soups, boiled egg, dry fruit powders, etc. Eat healthy, eat as per your tolerance. Have split meals, that is you can have every 2 hours rather than 3 big meals. You can eat with your children and family and share food with them too. Does sharing food spread cancer? No, definitely not. How should the lifestyle be during chemotherapy? Most common myth is associated is to stay separately. No. Please mingle with your family members. However, avoid crowded areas. Use a mask then. You can continue to work, may it be office, school, whatever. People continue to work, come here, take chemo and go back. Keep yourself occupied. Now, let's discuss some of the common myths associated with the side effects of chemotherapy. In modern era, with so much of development of supportive care, we see very less side effects. First common myth is chemotherapy is painful. No. Putting an IV cannula is painful, but chemo administration per se is not painful. It is like administration of any IV fluid. Second common myth is chemo will make me more sick, nauseous all time. I won't be able to eat. I will lose my weight. No. Nausea and vomiting are the most common side effects of chemotherapy. However, we administered medications called as antiemetics prior to chemotherapy and also after that to minimize nausea and vomiting. Along with that, having meals every 2 hours, that is split meals, will be beneficial. Third common myth is my immunity will be compromised permanently. No, there will be a drop in the WBC count usually around day 10 to day 12, that is for a short period of time, which usually comes back to normal once the chemo effect is over. So during that period, we advocate using mask and staying away from crowded areas. Fourth common myth is I will have hair loss permanently. No. Chemotherapy associated hair loss is temporary. Not all regimens do cause hair loss. Once the chemo sessions are over, hair regrows. During that period, if you want, you can use scarf or even a wig. Fifth common myth is chemotherapy causes permanent discoloration of skin and nails. Few chemo regimens do cause darkening of the skin, especially in the area of knuckles, nails, etc., which usually come back to normal once the chemo sessions are over. Few chemo medicines cause darkening of skin, especially the knuckles and nails, because chemotherapy acts on all rapidly dividing cells, but this effect is temporary. Sixth common myth is I cannot have a child post chemotherapy. No, not all chemos affect the childbearing ability. For those who have not completed family, semen preservation in males, oocyte or embryo preservation in females is advised. Couples can continue healthy but protected sexual life. Bearing child during chemotherapy is not advisable. Last but not the least, the biggest myth is chemo treatment per se is worse than dealing with cancer itself. Benefits of going through chemotherapy outweighs foregoing or quitting cancer treatment. Half treatment or defaulting chemotherapy can be even more dangerous. People do think that once they come back, the same regimen may be used. However, the reality is we would have lost the golden opportunity to hit the disease hard. Do not get scared or confused about your treatment. Please discuss with your oncologist, clear all your doubts, know the benefits of chemotherapy. Speak to the survivors and stay positive, which will help you to go through the chemo sessions and fight your cancer. Fight your fears with faith in yourself and in your oncologist. Thank you.